5 minutes to 9. Parents are being urged to vaccinate their children against measles following a sharp increase in the number of infections in England and Wales. There have been more than 300 cases so far this year, almost as many as there were in the whole of last year. Health officials are also worried about outbreaks in the rest of Europe. To talk to us about this is Dr. Peter Swinyard, the chairman of the Family Doctors Association, who joins us in our Oxford studio. Thanks very much indeed for joining us on BBC News.
My pleasure, thank you.
First of all, we've seen the sharp increase in cases all of a sudden. Why is that?
I think that wild measles virus tends to run in phases, and because of the lack of herd immunity in the population, we're now suddenly getting an outbreak because not enough people have been immunised over the years against measles, an immunisation which is safe and easily available.
But one assumes immunisation levels were probably, what, roughly the same last year and the year before. Why now this suddenly sharp rise?
Well, I'm not a microbiologist, but you do get these sort of trends of sudden outbreaks of viral diseases in the same way that we suddenly get flu epidemics one year, where other years there's hardly anything. And these things tend to be fairly sporadic. But I think the public health doctors, and I'm not a public health expert, I'm a GP, the public health doctors have been warning for some long time that there just is not enough herd immunity. And you only have to get a combination of unfortunate circumstances and you suddenly get an outbreak of measles, and it's actually worse on the continent than it is here.
Right. I mean, the suggestion is that perhaps because it has, there's been quite a number of large outbreaks on the continent, that it's been brought back to the UK.
That's entirely possible. The populations are very fluid these days. We all enjoy our continental holidays, and continental travel is fairly inexpensive and available to many people, and therefore diseases travel with people. Measles is an incredibly catching disease. It's very easy to get, and if you are in contact with someone who is about to go down with measles or who has measles, or indeed you can pick up measles from droplets that have been left up to an hour or two beforehand. It is a very catching disease.
Sure, but the underlying problem, as you've alluded to, is the fact that not enough children are being vaccinated against measles.
Absolutely.
In this country. Well, why is that?
Well, there have been all sorts of scare stories in the media. I would have to say not helped by former people in my profession who've come up with some very spurious research linking measles with other conditions, which has been proved now beyond all reasonable doubt to be wrong. And parents always want the best for their children, and parents always think, what is going to be the best for my child? And if you have scare stories in the media saying if you have measles jab, your child may go on to get another unpleasant condition, parents may be very scared of having those immunisations. And I've certainly had a lot of conversations as a GP with parents over the years where the weight of statistics doesn't actually overcome the emotional worry that people have over giving their children immunisations that they don't necessarily believe 100% to be safe.
OK, Dr. Peter Swinyard, it's good to talk to you. Thanks for joining us.
Thank you.